Dina. I'll be your nurse today. How are you feeling?
Oh, you're feeling well.
Oh, that's good. Can you please verify your first and last name for me as well as your date of birth?
Yeah, Alexis Diaz, September 19, 1998.
Oh, thank you. And do you have any allergies?
No, none.
Okay, I see here for my provider's orders that you do have a trach suctioning today. I'm going to go ahead and take a listen to your lungs just to verify that it is appropriate, and we're going to listen to how you're sounding. So is it okay if I touch you and pull down your gown a little bit?
That's fine.
Okay. Okay, then we're going to listen laterally and posteriorly. So I would have the patient sit up for me and assist me with that. And I do hear that you're somewhat congested. So could you go ahead and try coughing out those excretions for me? Okay, do you still feel congested?
A little bit, yeah.
Okay, so it is appropriate for us to begin. We're going to go ahead and type your oxygen application. I'm going to turn it up 2 liters extra from where he was. And I'm going to turn on the suction here. I'm going to place this over here so he has it. We don't have to contaminate our hands once we get our gloves on and all that. All right, so we can go ahead and begin. You're going to pour that in there. All right, go ahead and get our tubing ready. All right, so we are right hand dominant, so we're going to go ahead and grab this with our left hand. We are no longer sterile once we attach this. We're going to go ahead and test the suction. Okay, now we can go ahead and insert it. I'm going to go ahead and have you inhale for me. We're going to go in 6 to 8 inches. Right? And then we're going to pull out. And we're now monitoring for signs and symptoms of hypoxemia, looking at their pulse rate. We can go ahead and listen to their lungs again. And you do sound clear. I would go ahead and ask the patient if they wanted another round of the suctioning. Do you feel better?
I think I feel better.
That's great. So since he feels better, we can go ahead and discard our supplies. We don't need to go for another round. We're gonna put this on him, assuring that he's getting adequate oxygen, because that may have put him under some distress. We can discard these supplies. Okay. All right. So we're going to go ahead And do our hand hygiene again. We're gonna open this again, pour it in here. Alright, so we're gonna remove the inner cannula, making sure that we don't touch the inside there. We're gonna let that sit in there. Okay. We can also pour a little bit more of this on there to make sure that it's fully soaked. Okay. Now we're going to apply our sterile gloves. Okay. So now we've gotten this all clean, we can go ahead and place this back in. Okay, we hit the click so it's in there secure. We are no longer sterile. So now we can clean around his stoma. We're going to use this solution here that we haven't had the inner trach sitting in, the inner cannula, I should say. So as we're doing this, we're just assessing for any signs of infection, redness, swelling, discomfort, bleeding, any abnormal drainage. How are you feeling? Do you feel any pain around this area?
No, not at all.
Okay, perfect. Good. So we're just going to pat this dry. Okay. Now we can go ahead. We're finished with all of these supplies. We can go ahead and put on his new trach ties now. Not before. We're not going to remove the old ones until we put on the new ones. Okay, sir, you can just help me lift your head. Thanks. Okay, And then we would remove his old trach ties.
I'm sure you're fine. No.
And we're going to do one last respiratory assessment while monitoring the pulse oximeter, his pulse rate. We're just going to go ahead and listen to your lungs one more time. You can go ahead and toss these.
Might be like so much time with his mouth. That's what I just said.
I know, I started just putting it here. I was like, that's thank you.
Listen laterally.
Are you taking one of the two videos?
And then we would listen posteriorly as well if the patient is able to. And then we would go ahead and we would titrate his oxygen back to where it was prior to beginning, so down to 2 liters. And we would document the presence of the drainage. So what color was it? What was its consistency? How did the patient tolerate it? How did you tolerate that? I would ask him, or ask him how he's feeling. And then we would go ahead and just document how his stoma was looking and how he's doing right now.
Did I touch it with the right hand?